לא מלמד, לא בלמד. אני מפחד להדליק לך, או לפני שהדפת להם. אני להדליק לך שלא דבר.
Morning, everyone. Please take a seat. We would like to start. Please be seated. Please take your seat. Good morning, everyone. I'm privileged to invite Professor Iroyan to present and demonstrate the new breakthrough DSG technology. Professor Iroyan. Professor Iroyan is a maxillofacial surgeon and holds the position of the clinical director at ConfiDent company. We want to take this special opportunity to offer you to be part of this successful project and to enjoy not only the clinical advantages and benefits of the technology, the financial opportunities. Therefore, our financial consultant will be happy to explain the different options of investment. Yossi will be here with his team after the demonstration. So enjoy.
Thank you. I should not be close to this side. Thank you. First of all, good morning, everybody. And thank you very much for taking your time and be with us. This morning, we're going to have two parts. There will be a short presentation, I promise, not more than 15 minutes. And then we're going to do a live surgery in this special sterile bubble. Inside the bubble, already my bubble team is preparing the patient. And you're going to be witness and you will participate together with me in viewing this really breakthrough technology. With us today, beside your honor present, I have two special guests. First, it's Mr. Olivier Frézal, who is actually the father of this technology, and he's now the vice president of R&D in Escolab company. So if you have a broken instrument from Escolab, this is the man to go. And he is one of the most important pillars and promoters of this technology. And nearby, it's my daughter, third-year dental student, who came all the way to see this and to see her father in front of everyone. So, saying so, one of the most crucial things and most, let's say, demanding facts that we have in dental implantology, it's always to position our implant in a predictable, correct position and to use and to maximize the volume of the bone. And I think for years, the young and the more experienced doctors know that to gain this best option takes not only experience, but sometimes a lot of X-ray, a lot of preparing. So when I've seen this technology 2.5 years ago, I thought at the beginning that I'm dreaming. Because for years, all of us are looking for fast, easy, straightforward solutions. And unfortunately, we don't always have them. This is a French company called SpineGuard. So being a spine company, believe me, you can trust this product. And the product is called PediGuard, and basically was used in 80,000 surgical procedures all over the world for spine surgery. And the beauty of this technology is just about to be revealed to you. This is the DSG technology. It's a bipolar sensor in the front of this device that sends every second 5 pulses in front of the instrument. And those pulses get a feedback from the tissues where the instrument is placed. So making the things simple, it's a car system parking. And none of us would drive today or buy today a car without using a system of parking. The first question that my daughter asked when she comes back home to holiday, Daddy, the car has a system park. I said, yes, it has. Because we cannot concept today driving without using this system. So you have to imagine that this system now, it's in the front of your drill. And it's not only in front of your drill. Due to this wonderful idea, we have something that we don't have anymore at all in our industry. We have what is called anticipation, which means that the sound and the light that we have, it's not when the things happens, but before that. Because the electromagnetic field is actually thrown in the front of the instrument. So the surgeon can control and can predict what is happening the next 1.5 millimeter in front of it. Now, to get used to the sounds, you will hear three types of sounds. Cancellous bone, medium pitch. Cortical bone is going lower. And before you breach a vessel or a space, you will get a very high sound. I remind you, everything happens in anticipation. So when you hear this, you are not there, you are almost there. This is the beauty of the technology. You can correct me if I'm not wrong. We signed this global agreement with this spine company, which is situated in France. It's called, again, SpineGuard. And we are the leaders and the promoters of this technology in dental implantology. And this is what you're going to see today. This is the first instrument that is used in dental implantology. It's called Safeguard, and the company, it's called ConfiDent, and it's specifically adjusted and adapted for the use in oral cavity. But before that, I just wanted to say to you and to show to you what we've done as a base or an evidence base of this technology. We took this from spine, and we all know that bone is bone, but still we wanted to be sure that this is accurate and it gives the durability and the accuracy that we have in the spine surgery. So we went to Henderson, Nevada, which is a very famous institute where we can play a little bit with fresh specimens, and we chose to do a little bit different. First, we decided to take 3 different levels of surgeons. Very, very beginner that never in their life. Medium, experienced, The guy on the left side, it's Professor Horia Barber from Bucharest University, and he's an oral surgeon, an experienced oral surgeon, and myself, who am not very good but experienced, and we decided to compare the results. Each one did implants without knowing the length of the implant. We did a CT before, we performed the surgery, and then we did a CT after, and then we saw how we placed the implant. We published this last year, and it was a big surprise, regardless of the experience, regardless of the number of the implants that we've done in our life, regardless even about the training that we had. There was no statistic differences between the position of the implant. And this for us was really a huge reassurance that this technology will not only give us a gimmick, but a true learning and working instrument. We took it forward. Okay, we said it works on fresh specimens, it works in our hands because really we're very enthusiastic, but now let's take it into the real world. And this is the real world. The real world here, it's in the hospital, a maxillofacial department where we're doing the clinical study that we're gonna finish in a couple of weeks. And in this study, we've done the same thing. We choose randomly 20 patients, 80 implants. We gave the surgeons the instrument without seeing the CT scan, but we planned. We planned the cases, and you can see here the head of the department, Professor Sameh Suji, who is a very known maxillofacial surgeon, and he helped us a lot. And just to let you know that everything was done in his department. You will see the movies, and just to give you a flavor of what will happen after, this is one of the surgeries performed there. So again, you will hear here the typical sounds of the instrument, medullary bone, cortical bone, and just alert before it breaks or it penetrates the sinus. This is in live patient, live surgery. We prepared a soft planning for each patient because we wanted to know that we reach at least close position with the planning. And then we gave the instrument to the surgeons to perform the procedure without knowing and seeing the length of the implants. And you can appreciate the results on the CT scan, post-op CT scans. All of them were precisely placed without opening a flap, without doing any x-rays in the middle, and without knowing the length of the bone. We have CE, and in essence, this technology will give safety not only to the doctors, but also safety to the patients. And I think all of you and experience, if I will ask you first implant and where, you will all raise your hand because you will remember. You will remember those seconds of fear and of tension when you place the implants, and nobody was there to tell you you're doing good, you're doing bad, you're in a good position or a bad position. Second, we reduce almost completely the amount of radiation, because today even experienced need to do at least 2, 3, and sometimes 4 x-rays until they are sure that the position is correct. With this, besides having a pre-op and a post-op in the middle, you can rely completely because the accuracy is 0.3, and it's not from our literature. It comes from orthopedic experience. And of course, flapless. not always possible, but this is an option that makes things much better. So today, we prepared this case. It's not the right side, don't worry, it's the left side. It's Friday, so I chose only one implant. You will see that we're going to use a 16 mm implant, and you will hear it's a long osteotomy. So you will be able to hear the sounds, the different sounds, and I hope that you will be able to appreciate not only the way that this technology works, but the simplicity of the work and the way of doing this. So I'll take exactly 1 minute to put gloves and run away. אתה נכנס? אני לא נכנס או אני? באמת? Okay. Okay. Do you hear me? שומעים אותי? אז בואו נשים. Do you hear me? It's okay? I feel like in Okay, so just briefly, I want to present my team. On the right, it's Roy, my cameraman, who's doing all the movies. And with me, it's Dr. Noah Barrer. She's a specialist in oral medicine and with a lot of experience in general anesthesia. Hopefully, we don't need a general anesthesia here. The patient, it's Eric. It's a friend of ours. You have to be crazy to come here. Only friends can do this. Don't touch anything. Coffee for 3 days here, so he got a free implant. And let's go through the whole thing. First of all, I want to show you the case. Okay, so we're gonna show the clinical aspect of the case. This is the area, okay? And in this patient, we choose to do 2 different things that we did do this week, because in this week we use prosthetic stent, and in this case we're going to use freehand. So there is no prosthetic so positioning. I'm relying on basically on the crest and on my experience. This is the device. And as you can see, it comes in a double packing. It's a ETO, very sterile pack, okay, that you can open just before the surgery. And it has a plastic cover on the tip, due to the fact that the tip is very sharp. As I told you, this tool can be also used as an osteotome. This tool can be used also as a manual drill. It has an excellent ergonomic shape because it was shaped for hands of orthopedic surgeons. It has a nice place to hold, and it looks, as you see, very sleek and transparent. Now, in the back, you have this safety slip, which you need to pull in order to activate the device. It will probably not activate it because, you know, the rules of live surgery. No, it activates, okay. And in order to see that it works perfectly, we dip it into the saline. Okay? Now we have two types of alert. We have the sound alert, as you heard, and we have also the light alert. When this green light is on, you have the light, it means that the instrument is working at the tip all the time. So even that you don't hear, this instrument works. And the reason is that in orthopedic surgery, for long surgeries, if the algorithm was changed to work in the air, they would have get crazy after 8 hours of beep, 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 beep. Therefore, in the air, although it's working, you don't hear the sound. Another thing which is very important to remember, that fortunately and unfortunately, one of the best places to hear and to do this, it's in real-time surgery, because this instrument needs wet environment. If it's not in a wet environment, then it will not work. Therefore, all the models that we try to do are not as good as live surgery. So, we don't want to change the world. We just want to make it better. Therefore, we don't want to change anything in the sequence of how the implants are taught or made. We can now take this instrument and go straight forward and do the osteotomy. But what we want to teach is to go slowly, at least at the beginning, until you get the feeling and the way of the working with the instrument. So first of all, we're gonna do a regular pilot insertion with a regular implant drill. And now, I will take you through the sounds. Okay. Now you can see the dental markings. One of the advantages of the instrument that you can work with, of course, one hand, or you can give a support with the finger. You can hear now that the medular sound transposed now to a cortical sound, less cadence and less pitch. Now, no sound. In very hard cortical bone, you will not get audio sound, but as I told you before, the instrument, it's working. And now you have three options. You can stop at this level because now we are at the bottom of the sinus. One, we can continue and try to go inside to do what we call a bicortical stabilization at the floor of the sinus. And then you will hear again the high pitch of the instrument. Okay? I just crossed the cortical bone. I'm at the bottom of the sinus, almost. Huh? I will take a measurement tool just to show it to you. You can hear. אני יכול פה להיכנס קצת. יש לנו 13? Now, when I go back into osteotomy, I will have high pitch because the osteotomy channel is filled with fluids. So the pitch of the instrument is very high. Too many microphones here, don't see. Okay, I am not breaching yet the sinus. I'm just before breaching the sinus. This sound, it's called alert sound, just before breaching. I'm taking a chance here with you, but it's the last day. I'm vanishing tomorrow, so I don't care. Now, at this point, we're going to place the implant, but at this point now, you can take the instrument out, take osteotome, Versa, piezo, whatever you want, do a closed sinus lift. We won't do it tonight, don't worry. We're going to place the 16 millimeter Adin implant. I do apologize for those that place them with the head drill, but I'm not doing this. Usually I'm placing it manually. We're going to show you in a minute. תיקחו לי את המיקרופון ממני. תודה. Now, you have to appreciate, we did the drill with 2.5, and we are placing a 375 implant. So this instrument also is condensing very nice the bone. I can tell you that yesterday we did the same in the upper jaw using a 5 millimeter diameter implant. Okay, Gaza. I want to show you how it looks. Now, it's not a pleasure for me because I'm a maxillofacial surgeon and I'm used to a lot of blood. But you can appreciate that we almost did zero suction, very, very sleek procedure. And you will see that he will be able even to get up and drink and eat and breathe. So my team will finish up this. Thank you, Eric. And I'll come out for questions if you have. Yes? Okay. So, again,